So hello everyone, welcome to Momstar Series, and today we have Mrs. Tejaswini. She's from Andhra Pradesh, and welcome Tejaswini.
Thank you, ma'am. Thank you so much. How are you?
Great. So Tejaswini, first tell us in brief about yourself.
Well, I'm Tejaswini. I'm from Andhra Pradesh, but I'm a software engineer working in a company based out of Hyderabad. I'm just a mom of one baby boy who was just 4 months old as of now. Yeah, that is like a small introduction of me.
So Tejaswini, now tell us what was your biggest challenge in your breastfeeding journey?
The biggest challenge is my first thing is my milk supply. It was like a very it's like the drops are only there at very first month. And the other is the latching part as well. The baby to latch. So two issues were like the main things which I
got it. So now I'm just giving a brief to our audience about how was your journey, and then we'll have it in your words. So when we reached, when we both connected, that time it was August starting. 2nd August, we had our first consultation. Your baby was 15 days old by then. And then we had a consultation where your formula was around 10 to 12 times you were giving at that time. And direct feeding was there around 6-7 times, but the baby was crying a lot. The baby was very cranky, fussy on the breast. So that time it was there. And then we had a talk after around 10 days. By then, by following all the protocols which you were already following, your formula had come down from 10 to 12 times to 6 times. Okay, but the quantity had increased. That was also there. And you were pumping at that time because you were direct feeding, but it was not very helpful by then. So you were pumping also at that time. So like 6 times you were giving, 4 times you were giving express breast milk, and 6 times you were giving formula milk by then, correct? And then on 22nd August, we had our third consultation. By then your formula had come down to 1 time, and that you were giving by Palada. And I made some changes in the last protocol, and accordingly we worked. And that time your pumping also came down to only 2 times, and your direct feeding was increased by then. You were 8 times direct feeding. And I think that was the game changer at that time. So, and this was 22nd August. And then we connected again on 30th August. By then again, your formula came down to 1 or 2 times. And this was, at that time, you stopped pumping. It was full by direct feeding itself. And then on 6th September, we connected again where you said that I have not given formula since 1 week. So that was the happiest thing. So it took nearly 1 month for us from coming from formula 10 to 12 times to 0 formula. We started on 2nd August, and you told on 6th that I have not given formula since 1 week. So one thing I would like to just tell all the mothers who are watching here, that if you by anything, by any suppose if you are not given proper knowledge, or you didn't have awareness about the things, and you had to give formula, and it is too, like, you're giving a lot of times formula, still you take an example of Tejaswini. She came down from 10 to 12 times of formula to 0 formula within a month. Now Tejaswini, you tell the whole journey.
Yeah. When the child was born, I was not at all aware to get him onto the breast and give the latch. So the people around me were saying that we need the milk to flow so that the baby can latch. So at that time, the milk was like literally drops, just like when I'm trying to express or pump it with my hands, I'm just seeing 1 or 2 drops. At that time, they had tried to latch the baby to me, but he was not at all cooperating. He's like crying because he's actually hungry at that time. So I've just been waiting that 15 days. I was just waiting for the milk supply to increase. I was not at all aware that I should be doing something for that. So that 15 days passed by, nothing is happening. Milk is not happening. I'm just giving the formula milk only. Through this Instagram and Facebook, I got to see your webinar. So I thought I'll give it a try. I'll see what I can get some info from that webinar. Then I joined the webinar. The way you explain the benefits of the breastfeeding. Nowadays, people are saying like formula feed is also fine, even if you are not breastfeeding. But when you like explain that breastfeeding has its own benefits and perks, and even it's not, we can give, I can give breastfeeding, right? I felt that confidence when I have like reached to you on the webinar. I have like asked my question on that webinar as well, where you have like given a proper answer. Then I thought, yes, I'll get a consultation from you. Let's see how I can make a change in this. So in our first consultation itself, I become very confident that at least I'll be able to achieve some change in my journey. So I got your the lactation mix and whatever you have suggested to take, the supplements and things. When I've started them, I like just started the changes in just 2 to 3 days. I was able to see the increase in my milk supply. I was totally surprised because I was doing some other things to increase supply, but nothing yeah, nothing came in there. But yeah, taking all these mixes and things, I have changed a very good ingredient in milk supply. I was totally happy about that. And by the time, like, I was already pumping, right? So the pumping output is very nice. So I thought, okay, I was at least able to pump, and I was at least giving him the pumped milk as some part. Then in the next session, when we were like seeing the latching issues were there. So we sent you the videos of the latching. You have like corrected me. At first, I was not able to know how to hold the baby to the breast also. Like, even the people around me say that you should be holding like this or like that, but that latch, yeah. But yeah, with the help of you, I was able to keep him properly at my breast. And at first, he was not able to do the sucking also because he was not aware how to latch. But slowly, he too started learning. We were slowly coming to a better latch at that time. Then I had this sore nipples. That was actually another issue we faced in the next conversation. Like having this bleeding nipples, literally, feeling tense when he is crying for milk because I need to keep him breast at the same time. But again, suggested some other solutions for me at that time. So that actually literally helped me very much at that time. So then slowly, very slowly, it was like I felt like few days it was I was not able to take much effort, but slowly and happily, when the formula intakes were decreasing, I was very happy at that time. So I was actually able to breastfeed him properly. And yeah, and now it's finally he's completely breastfeeding. He's very happy. He's happily playing and everything. I'm like formula complete. But with the formula also, it is very difficult for me, right? He will start crying. I need to come here, mix it up, mix things up. Then go to him. I was using Palada only because the people said me if you are using bottle feeding, you might get confused with the nipple. So giving Palada, that 30 ml giving with Palada only is also very much
Was very, yes, correct.
Yeah. If it is completely breastfeeding, it was like completely fine for him as well. With Palada, he's crying in between totally, but breastfeeding, he is like happily feeding. So there is this misconception that if that milk is not coming, you'll not be able to get the milk later on. So that is not that you can get the milk. That I was able to learn from you.
That's true.
I'm totally grateful. I just thought it was a miracle that he was breastfeeding now.
No, it is not a miracle. It is just the right guidance and the right support, basically. Once you get the correct path which to follow, and I know mothers, they have a lot of strength. They just have very good strength. You just need to show them the correct path. And whatever obstacles come in between, you have to like talk to her and explain her. Once she's a good listener, good follower, then 100% she's going to get results. This I tell to all the mothers whom I consult. If you follow exactly what I am telling you, don't make changes here and there, and then you will obviously get results. That is the main thing.
Yes, doctor, exactly. The first time I have talked with you, you were saying with this much confidence, don't at all worry, you will be having the milk, you will be able to feed him. Then I really felt very positive energy in me. Till that time, I was totally discouraged. Like, will I be able to breastfeed him? But after talking with you, I just got that positive energy, and I was able to take those steps which you are actually suggesting me. Talking with you first time is actually very helpful for me at that time.
Yes. Actually, a new mother, she obviously she would have tried a lot of things. And if she's still searching on the internet for help, that means that she's really worried. And if I can soothe her, if I can instill confidence in her, then only she will be able to work wholeheartedly. So that is the most important. Other things will come up. First, I need to motivate the mother, because I understand that she would have tried a lot of things, and when they are like not getting anything for her, then only she's searching here and there. And still, if she's searching, that means she really needs support. Other things will all come late. First, to instill that confidence is very important, and that's what I just do with mothers. Sometimes I just tell them that I am more of a counselor to you all, more rather than a doctor, because I need to just keep you on the track.
Yeah, that's true, doctor. Yeah, that is actually definitely needed for our mothers, because we have been through a lot till the time that we are reaching you, right? Yeah.
And that too also, when I have a talk with the mother, after that, if she's searching on the internet and going somewhere else, then I have to keep her on the track. Don't go here and there, be on the track, because they keep asking that should I follow this, should I follow that? Then I have to tell them, no, come here, follow the same track which I am telling you. So this is one thing which I need to do to keep them track. And that's what, there comes the importance of regular follow-ups, which I'm seeing that you have been regular follow-up. Whatever date I told you that we need to consult on this day, you were there. Sometimes, due to some things are happening in the family, some guests or some functions, people they just postpone the consultations, follow-ups though. And that after some time, which I have given you a protocol to follow for few days, whatever time, and if that time is elongated, then obviously it gives problems for me also to get back the things into this. So that's why we got the results in within a month, because you followed up properly. Whatever date I told you, you were there on that date. That is the most important thing too for everyone. So now one thing, because you are from Andhra Pradesh and I am from Uttar Pradesh, we are so many miles away. So people usually they have a doubt that will it be okay to have consultation on online and get results. So how was your experience with the whole team and online experience and everything?
Actually, at first, I too had the same question in my mind. Like, is it fine, like just having the lactation consultant through online, will it work? Because you should be seeing the latch and you should be working out on those things, right? I actually searched for the people near me. I searched in the Google lactation consultants near me. I couldn't find any. But yeah, when we connected and you were saying like, send me the video, I'll show you everything. And I have sent you the video just like you asked, and you have shown me, okay, this is the way, that is the way. It really worked. So it's not like this online communication is very better. It's just like in person how we are doing things. We are just doing the same way in this communication as well. So yeah, with the first consultation itself, I was like that part of the question was removed from my mind. I was totally comfortable through this online mode only, and I'm happy that even though you are that far, I was able to get help from you. I'm totally happy about that. Yeah.
One positive thing I feel about online is the regular follow-up system, because with a small baby, sometimes going to the clinic might not be possible on the same date where the doctor has called you. Online is something which you can just hand over your baby for some time to someone and go on the call and get. You don't have to carry everything, get a bag done for the child to move to the clinic and all that. So that way I feel online is better, because my follow-ups have increased. My rates of follow-ups and success cases have increased once I shifted to online, because previously I used to, obviously I too come from the same thing, that online was not very popular when we were starting our career as a medical doctor and all that. So I was also in a hitch whether online thing will work, but it worked, and it is giving such good results. And that's why I even suggest the mothers who are from my same city that you first continue with the online, and if it is required, you can come down to the offline things that way.
So. Yeah, it's true actually, because let's say I have a very small issue that baby is latching in such a way, but not in this way like you suggested. It's just fine. For that simple question, if I need to come to the your hospital or something, it would be a little different. The baby just like it.
Yes.
They're directly suggesting it through the this internet mode, so it is very useful.
Definitely. One more thing, babies sleep usually, because in the way they sleep, and by the time the parents reach with the baby to the clinic, the baby is sleeping. And how to wake up a child, because they are very small, we can't force them and get them.
And sometimes they get cranky also. So
yes, sometimes as they wake up, they are so cranky, they will not at all cooperate. So that time it becomes such a challenge to have the baby at the clinic and work for the latch and everything that way. But still, that kind of feeling whether the online will work or not, that is a hitch with most of the people. But that's what these stories, that's why I just want all to create this kind of awareness that with the technology, with such good technology, why should we use it for the medical treatments and all that? When world is going digital, why not we as medical people in this?
Yeah, definitely we should use these things.
And how was the team experience? Everybody was good at supporting you for the team and all that?
Completely. Like they were following up on my medicine tracking and even this consultation tracking. Everything was perfect, smooth, no problems were there. If I'm having any doubts or things, if I'm reaching out to them, they were responding very quickly. Just like that, they were just texting back and making calls and giving answers.
Yes. So we have a full dedicated team working in all the departments just to help any mother if they are having, because I understand sometimes I might not be available at that particular time when the mother needs me. So there is a dedicated helpline number and all these things so that the mother can get help directly. And suppose if something is there which needs to be tackled by myself itself, then obviously I'll take time and will advise accordingly.
They were totally available at any time.
Great. Okay, so now what message do you want to give to the expectant and fellow mothers?
So to the expectant mothers, I'll say that first just take some classes or something, whatever it is, like after delivery, what you are expected in your breastfeeding journey, like what things you need to keep in mind, how to make sure that you'll be starting your breastfeed journey as soon as the baby is born. That you should be learning before the delivery itself. That I have kind of missed at my part. So I thought it would be very useful to have it before delivery. And the mothers who are actually feeding through formula or whatever, if they're having some issues in the breastfeeding, just like you said, getting correct information person and the suggestions, that is very necessary. I mean, don't be discouraged that you will not be able to feed. You will definitely be able to feed. It's not every mother can breastfeed. I was able to believe that part from you. Every mother. So it is your choice and it is your thing to go through that journey. It is starting that journey by taking small changes in your
Yes, correct.
That's right.
And yes, and I got this feedback from many mothers that it is so important, but I didn't know about all these things during my pregnancy. So even now I'm taking this breastfeeding preparedness session also. Like if any mother is pregnant right now, so I advise her what you need to do, what you need to know in your pregnancy itself, so that after delivery you're not dependent on your family or on the staff from the hospital to latch the baby. You should know the correct technique. You should know when to latch, how to latch, and all these things, and what is the issues. You should know about engorgement, you should know about the letdown, you should know about everything, so that you are not confused by people whatever they are suggesting you. You know the correct thing, because after delivery there are so many people giving you advices and all that, and it is so confusing what to follow and what not, and it jeopardizes everything. And what simple things you need to follow, you're not able to follow those things basically. So this is so important. So Tejaswini, yes,
will have multiple opinions after the time. Some will say, do that, do this. Like you said, it will confuse the mother's brain. It will be like already helpless at that time without this breast milk coming or some issues if she is facing. By hearing these many opinions, she will be totally frustrated.
Yes.
we should be having this info beforehand so that she can handle the things.
Yes. And what happens if she's working also, she's trying other things, but multiple things she's trying at the same time, then obviously she gets confused which thing to follow, which thing is working, which is not working, which is clashing with each other. Two things might be clashing with each other. And that is so frustrating for the mother. She's not getting results. Her doctor is against her, after her. Why are you're giving formula? Why are you giving formula? She feels as if that she is giving formula. She wants to give breast milk and it is not coming. What to do? I understand. Got it. And that's why it is so important. And imagine if she knows everything. Just after delivery, she knows where my baby should be. She should know. She should tell others, give my baby to me. Let my baby latch on the breast. So this way, when she's like empowered this way, the others will follow it as an example and they will pass on. I had a mother, she delivered and I obviously told her what to do. So as she delivered, she asked her baby. So the sisters were like, no, it has to be in the NICU. The baby has to be kept. She said, no NICU, give my baby back. Let me talk to the doctor. Let me talk to the pediatrician. So she had a talk with the pediatrician and pediatrician allowed that, okay, you can keep the baby with you. So she took the baby and she kept the baby with her and latched well and everything. Second, third day, that particular floor where all the patients were admitted, of that floor, all the nurses came to her room to see how the baby was latching on the second day itself. So she was telling me, ma'am, I was showing, all the nurses were coming and seeing how is the baby latching on the second day itself. So that is the power. And she was so happy that I could be there. And the nurses, while seeing there, they were going and advising the other mothers how to do that. So I really felt so good. And I said to her that that is so good now when you see what you have taught to a mother, she's further teaching it to others. It's so nice feeling. It was a nice discussion, Tejaswini, and thank you so much for coming here and sharing your journey with us and helping me create more awareness about this issue. Thank you so much, Tejaswini.
Thank you, doctor. I am more grateful to you. Thank you so much.
Okay, take care, Tejaswini. Bye-bye. Thank you so much.
Thank you, doctor. Yeah, bye.
Thank you.